Good morning, I'm Dr. Monica Sickler. I'm here from the 5th Medical Group at Minot Air Force Base, and I'm also the Acting Public Health Emergency Officer at Minot Air Force Base. And this morning I'm just going to do a little bit of a talk about post-flood information briefing, talk about what some of the things you should do when you go back into the home and just to be safe from a medical aspect. So initially, when we had our members go back into their flooded homes, we had to make sure that everything was safe going back in. That was electric, gas, make sure all that stuff was turned off. At this stage, most of that is turned off, and the city's going back in and trying to turn electric back on for areas that weren't very well, weren't affected as much. But for the most part, that has all been turned off, but it might be a good idea just to make sure there is no electric on anywhere of your property, and just make sure you clear that with the city first. Okay, when you think about going back into cleaning a flooded home, the area, you need to think about having a plan. This would include several different things. The plan, think about how you're going to be safe out there, what type of food you're going to be able to eat while you're working, you're going to give the other people that are helping out, the shelter that you're going to be working in, shelter that you will have if it rains, if it gets too hot, and then also how much water you're going to have. This is very important because at times it's very hot out there still in Minot, so we have to really think about this previous to going in. So keep an eye out. When you first approach the homes, I've been down there, looked at a lot of them. Many of them look pretty safe from the outside, but you just have to keep an eye for any cracks or structural integrity or anything like that that might be a potential damage that can give you problems down the road. Many times inspectors have come by and looked at the homes, so that is also gives you a little backup reassurance, but you just need to keep an eye out for that. And just think about the floors and if they're safe to walk on. When you walk out on they've been, with a lot of water for quite a long time, so some of the floors could be unsafe. So you're going into those areas, really think about that. And watch where you step. There's a lot of sharp objects out there. Initially, there was a lot of standing water. Many times at this stage, there might not be as much standing water, but you have to think about where you're going to be putting your feet. It might be common sense, but just think about that because you can get a lot of injuries that way. Just always be mindful of this. And really ventilate the house and home that you're going into to clean up. Make sure that it has all the windows open. Get that ventilated well before you go and work in it each day. Okay, one thing that we're seeing in the clinic a lot of is back injuries. This is because we're out there working, lifting things that are heavy. We might not have been doing it very often. We're out helping a buddy after we've worked out at work all day, so we need to make sure we plan that job as far as how we're going to actually physically be lifting, be working. Use equipment as much as possible that can help you with moving items. Try not to take one big trip of all the items. Take several trips. Think smart about it, and use other people for help. And then the common thing is we say, always bend with your knees. Don't use your back to lift up things. Really use those strong lower leg muscles to lift up heavy objects. If you're able to, get knee pads and use knee pads if you're going to be down bending on your knees a lot, and that was going to protect your knees quite a bit. And then take breaks often and stretch. That's going to be very important. And if you need to be seen by a provider, you can be seen by a provider, and we can go through some more of those activities with you and evaluate you further. Okay, think about these injuries. If you do get injuries as far as cuts, if you get cut with metal object or anything like that, you need to make sure that your tetanus is up to date. If it's typically all the active duty military members should have their tetanus up to date. 10 years is the date range, so after 10 years it needs to be another tetanus given. If you do get an injury, you need to make sure that tetanus has been updated within the last 5 years. If it has not, or you are unsure, please come in to the medical provider and get a tetanus booster, okay? Make sure you just use a lot of, if you do get an injury, wash it really well with clean water and soap, and make sure you get all the debris out as much as possible. And then seek medical attention, again, if there is any signs of infection. And just one thing we need to do is, if it is oozing, any redness streaking up the legs or arms or wherever the injury was, you need to make sure you get in right away. Okay, if you don't treat it, it can turn into a severe infection, and this is just to give you an idea what can happen if you do not treat the infection, and this is somebody's foot. It can move very rapidly. It can be very kind of insidious, the infection, so keep a close eye on it. One other thing that is a big topic is mold. It's everywhere in Minot, it's everywhere in the homes. Just remember, if you have any lung problems, anything like asthma, COPD, please make sure that it's well controlled. I would recommend to avoid those areas until you've seen your provider to make sure that it's okay to go back into cleaning the damaged homes, the flood damaged homes. Most people are going to have symptoms that are very mild, like runny nose, eyes, nose stuffiness, things of that sort. So just even if you're not allergic to mold, you can still have those types of symptoms. So if you are concerned about it and it is giving you a problem, you can come into the medical provider and they can treat you for that. It's usually very mild. So if you do have breathing problems, get out of the area and make sure you go seek medical attention for that. If you do see mold on a hard surface, just make sure that you clean it really well. We do recommend a 1/4 cup of bleach with a gallon of water. Make sure you ventilate, again, the area very well. And just scrub it down and let it dry. There's some other materials that you can use to clean mold that may be more specific, but this is just the recommendation that we give that's simple and easy. Go ahead and get it cleaned up. Don't waste your money about trying to get samples of the mold to find out what type of mold it is. Just clean it up, okay? And don't mix bleach with ammonia, just a little reminder on that, and make sure you wear your good protective gear, and we'll talk about that later. And of course, like I mentioned before, thorough drying of the areas that you've cleaned. This is just to let you know about the heating and cooling systems in that homes. There's a lot of ductwork in there that's going to have insulation, and that insulation is going to carry mold in it. So if it wasn't damaged, if the system wasn't damaged that much, really think about getting a professional in there to clean it before you turn it back on, so that that mold won't be distributed throughout the house and to other people in your family. This is one thing about removing water slowly from the basements. Most of the water has been removed from basements, but there's some people who are still having problems with this. It's a reminder to always remove 2 to 3 feet of water from the basement at one time. Wait 24 hours, and then if the level rises, you need to stop until it stops rising again. And if it does stop rising, then you can go ahead and remove another 2 to 3 feet. So this is just to show you, a diagram to show you that it can collapse if you remove it too fast, okay? So personal protective equipment, always use hard-soled boots. Don't use sneakers out there. Really think about what injuries you can get to your feet. Use rubber gloves, heavy-duty ones if you can. If you're unable to get heavy-duty ones, use rubber gloves, and maybe think about putting a harder leather glove over top of it. Long-sleeve shirts, long-sleeve pants. If you can afford Tyvek suits, you can get Tyvek suits. Try not to use any pants that are torn, ripped, so you don't get the chemicals or the debris on you. Use respirators. We do recommend the N95 respirator. These respirators are available in town and also on base. They will protect you from most of the debris, the mold spores, and most of the splashing that you might have if you're out there working. So just think about getting those before you go out there and work, okay? Goggles, we recommend having the goggles with the splash guard on them because that will help protect from some of the material that you're going to be out there, and this will protect your eyes, of course. Hard hat if you need it, that is also recommended. If you think that the area might be structurally unsound or there might be things falling from the ceiling. And then using disinfectant wipes. If you have those, make sure you clean off yourself very well, clean off other things that you're going to be touching very well before you touch yourself or your family again. And then also we recommend not going out there and smoking in these areas too. Salvage materials, there's porous versus non-porous. Basically, if anything if it's absorbent, couches, things like that, most of that stuff has been thrown out already from homes. Drywall is also something that soaks up water really well, and also mold grows on it very well. Get rid of that. And a lot of other types of furniture, stuffed animals, things like that. Any other hard surfaces you need to clean very well, sanitize it with the bleach mixture. If it's a toy that you might be giving back to your family or donating, make sure you get that cleaned off, all the bleach cleaned off as far as with plain clean water. And then any pre-1980 construction, remember there's asbestos in there and lead-based paints. So have your children avoid going out into these areas to clean up. Keep them protected first because the lead-based paints could be out there. And then also asbestos is typically going to be wet, but if it does get kicked up into the air, make sure you have your N95 masks on to help protect you from that. Okay, so this is kind of what it looked like in Grand Forks in '97 for their flood, but it's starting to look like that out in Minot. The city did recommend that we break it down into electronics, large appliances, hazardous waste, and other debris. But I understand this is very difficult to do, but if you can do that, it will make the pickup much easier. Okay, sanitation. Just remember that everything was, contaminated with sewage for the most part out there, and we just keep that in mind when you're out there cleaning. So make sure you bring it in your own water for cleaning. If you don't have any hookups for water out there, just think about that. Again, sanitize all the surfaces, hard surfaces, with 1/4 cup of bleach per gallon of water, and ventilate that area very well. And then just remember that there might be an odor out there even after you've sanitized the home and the other materials, because it might just stay in the air for several days. Okay, food safety, there shouldn't be anything that we should be keeping at this point, but you can, if you do see any canned goods that aren't bulging or dented, you can salvage those, remove the labels, and again, clean it with a bleach solution to sanitize it and dry it really well. You might want to write on the can with a Sharpie or some other permanent marker to say what type of food it was in there. But any other foods need to be thrown out. Okay, cold and heat stress. If you're going to be out there in working for long periods of time, remember that you could be sweating a lot, your socks could be getting wet, you could be getting cold and heat stress if you work in the middle of the day or late at night. Make sure you change your clothes often if they're very wet. And think about things like trench foot even. You might not feel your toes after a while. If they're very wet, you can get numb, so you might not feel any damage that you're doing to them. So check them often. Bug spray, there's a lot of mosquitoes out there. Bring your bug spray. Also sunscreen. If you're going to be working out in the sun for long periods of time, we recommend the sunscreen. And then every hour, make sure you hydrate yourself with 1 liter of water, okay? And please pre-hydrate before you go out there. Make sure that you have already tanked up on good fluids before you go out to work. And then if it's the work rest cycle, we typically say 50 minutes to 10 minutes of rest. But if it's getting more warm out there, if you feel like you need to switch it up a little bit. You don't have to follow that exactly. Just make sure you're getting enough rest, okay? And using the disinfectant wipes, alcohol bleach-based disinfecting wipes are very good. And avoid touching the eyes and face after you're cleaning things up. And just remember, there's no running water out there. There is no plumbing available in most areas. They do have porta potties on the corners. So just remember to bring materials that you can use to help keep yourself clean. Okay. The other thing too we need to really remember is keeping ourselves psychologically healthy. We like to really point out that people are really having problems with sleep because they're working all day and then they're going out there and helping their buddy clean up their house. So this can be a problem because you could get very fatigued, you can have problems driving, problems with work. So make sure you get enough sleep, okay? If you need more sleep, keep that in mind, okay? Continue to exercise regularly. This is very important to keep that normal cycle up so that you're very healthy. So it helps with your immune system, keeping you very strong, and then also psychologically fit. Talk to friends, coworkers if you're having any problems. Also, we have health professionals that can talk to you if you are having any concerns about the stress. Continue to take breaks, as we mentioned before, and practice relaxation. And also, healthy diet is very key. That just is intuitive, but keeping that body strong and fit also needs a healthy diet. It's easier to go out and get junk food, but we recommend to try to plan ahead a little bit on those cases. And then just continue to engage in regular pleasurable activities. So if you're going to take a break with your family, go out and have fun, enjoy that time, and then go back to work, okay? We do have resources here for the psychologic health base. We do have behavioral health consultants and primary care. And these are mental health providers that will schedule you under a primary care visit if you want to see a doctor, just to talk to them about some of these stressful situations. It's not going to be booked under a mental health provider. It's going to be them just evaluating you, talking to you, and it's available in PRP and the PCO clinics. Think about the stress management groups that we have, 12 o'clock every Tuesdays. It's over at the mental health clinic. It's booked under a primary care visit, and it's just a walk-in appointment. So they'll just mention it that you came to the appointment, okay? And then sleep enhancement classes. If you're having problems with sleep, this is also available. It's 12 o'clock every Friday in the mental health clinic, and it's also walk-in. And then right now, the mental health clinic is available to spouses too of active duty. So if your family is at home working on the home and you're at work, think about the stresses that they might be having and talk to them about that, okay? There's other services available. We do have here on base, there's the military family life consultants and child and youth behavioral specialists. These offer counseling services, and those are the phone numbers there. Also, we have the Airmen and Family Readiness Center, which provides education on personal life and work issues. Think about your chaplains. They're very helpful for people. And we also have the mental health services here. And then really utilize your first sergeants because they're going to have a lot of information for you. So that's basically the information I have for you today, and that's it. Thank you.